So before I go into the patient's room, I'm gonna watch the patient and monitor to see how she's acting with her family before I'm there. So I'm gonna make sure that there's no signs of postpartum depression. I'm gonna make sure that she's coping with her baby well, that she's interacting with it, and also with the family members around. And I see everything's normal, so I'm gonna go in the room now. So I'm gonna knock, enter room. Hello, Mrs. Smith. My name is McCade Cox, and I'll be your LPN today. And as I'm talking, I'm also gonna put on some gloves and hand sanitizer. How are you doing, Mrs. Smith? You're doing really good? Happy to hear that. So I'm gonna put on a set of gloves. So Mrs. Smith, since it's my first time seeing you, I'm gonna be doing a baseline assessment. I'm gonna be getting all your vital signs, and I'm gonna do just a general assessment on you. Is that okay? Perfect. So Mrs. Smith, is there any cultural or family practices that I need to know about? No. Okay, perfect. So I'm gonna start by getting your vital signs. So when I was talking to her, I was monitoring her respiration rate, and we want it between 12 and 20, and hers is at an 18, so it's all within normal limits. And then we're going to put her blood pressure cuff on this arm and her pulse oximeter on this arm. And her blood pressure is 126 over 72, so it's within normal limits. And we're also gonna check the O2 stat. Her O2 stat's above 90%, so we want to keep it between 90 and 100%. Hers is a 96, and it looks like her pulse rate is an 82, which is within normal limits. We want it between 60 and 100. And then we're also going to check her temperature, and we want to keep it right around 97 to 99. So we're checking it. It's a 98.4. So Mrs. Smith, we're gonna monitor your temperature while you're here in the hospital. When you go home, we want you to report if you're fevering above 100.4 degrees, okay? So you just need to call in and let us know. Call us to the physician. We'll let you know what to do after that. Okay, so now while we're doing these assessments, we're also gonna do a lung and heart assessment. So we're gonna listen to her lung sounds, very first, and we're listening for bronchi, wheezing, or any other lung sounds. And we're going to listen to all these sections for about a minute. Okay, everything sounds good. There's no bronchi, no wheezing, and her breathing's normal. Now we're going to listen to her heart sound. And while we listen to her heart, we're going to listen to the 5 different locations. And we're going to listen to each of them for about a minute. And while we're listening for the heart sounds, we're listening to make sure that there's no irregular heart rhythms. We're making sure there's no whooshing sounds. Everything sounded normal within normal limits. So after we're done with those checks, we're going to do a breast examination. And with this breast examination, we're going to ask her to do a latch score. So the latch score consists of the latch. So Mrs. Smith, how is the baby latching? So she's latching good. Good. When I was here last time, I could hear that when the baby was feeding, I could hear the sound of her swallowing. And then we're going to look at the type of the nipples, and it's an inverted nipple, which is really good. We're looking for any cracks or bruising or bleeding, and it looks normal. And we're also going to ask how Mrs. Smith holds the baby. Hey, Mrs. Smith, so when you're feeding your baby, how are you holding it? She's holding it in a football hold, which is perfect. Football hold is one of the best ones you could have for a C-section, but she had a vaginal delivery, so that's good either way. We're going to move down to her abdomen, and we're going to maintain privacy by keeping the blanket down over perinal area for now. And when we're doing abdomen, we're looking for any abnormalities. We're making sure it's not distended or bulging before we touch it. And we're going to fill the uterus. And as we fill the uterus, we're filling to see if it's firm or boggy. And if it was boggy, we'd give it a massage, but it's firm. And it's 2 fingers down. So Mrs. Smith, it's important to have a firm uterus because that means your uterus is contracting properly, which is going to stop the bleeding after delivery. So it's really important they have a firm uterus, and you do. So everything's normal there. Okay, and if it was a C-section, we check for the incision site. We check the incision site to make sure there's no bleeding, there's no odor, we know the type, the amount, and color, and the odor of any kind of bleeding or any discharge was coming out of the site. And we'd let the physician know. And the reasons that you'd have a C-section would be because you'd either have placenta previa, placenta abruption, or if there was fetal distress in the baby before it came out. That's just a couple of the reasons why. And the fetal distress, we'd only do a C-section if there was no other options. Like when we repositioned the patient, nothing worked. And if she had a C-section, we'd also check the IV. We'd make sure that we'd check what kind of gauge and needle, where the location of that, make sure there's no phlebitis or no other reddening or swelling around the IV site. We check the flow and the amount and the type of medication given. She'd also have a urinary catheter, and we check the color, amount, and consistency of the urine. And while we're here at the abdomen, Mrs. Smith, are you voiding? Are you having a hard time voiding? Is it painful? Does it hurt? Okay, you're not having a hard time with that. Have you had a bowel movement yet? Nope, you've not had a bowel movement. Okay, so I'm gonna listen to the bowel sounds. Make sure her bowels are waking up since she's delivered, and we're gonna listen up to 5 minutes, up to 5 minutes so we don't hear it. But her bowels are awake. I can hear them; they're active. So listen to them at a couple different spots. Okay, everything feels normal. So at this point, we're done with the abdomen. So we're gonna cover her back up, and we're gonna go down to her perineal area. We get to her perineal area, we're gonna check for any lochia, and it looks like she has a little lochia discharge, which is normal. So we're gonna teach her that lochia is normal for a couple of weeks, that first it starts out red, then it turns pink, and then it goes translucent color. So it's normal for the first few weeks. And then with this pad, we are going to take this pad and we're going to measure it to see how much output of lochia she's having. So we're going to take it, we're going to measure it, and we're going to come back and we're going to teach her how to clean herself when she voids. So we're going to do that right a second. So we're going to fill, when you go into void, we're going to fill this bottle with lukewarm water, not too hot, not too cold. So after you void, we want you to spray off your perineal area before and after you void. We're doing this because when you wipe after, it hurts after delivering, from what I've been told. So instead of wiping, you just pat it dry after you use the water bottle, okay? And we're gonna take this pad, we're gonna go weigh it, and we're gonna discard it, and we're gonna get a new pad. I'm gonna teach you how to get pads for comfort, okay? So first, we got the pad, which is pretty self-explanatory how to use it. But with this pad, we have a couple different medications and stuff that's gonna help you feel better, okay? Down here. So first, we're going to use the witch hazel. And witch hazel are these little pad things here. We're gonna use 3 of them. So what they do is they're a numbing agent, and they also cool down your perineal area. So we're gonna use 3 or 4 of them, however much it takes to cover your pad. So 3 works for you. And then we're also going to put on this ointment, this Duvocaine ointment. This Duvocaine ointment has a couple different reasons why we use it as well. It's also a numbing agent, it cools it down, but it also keeps your perineal area soft. Not soft, wet, so it doesn't dry out. So we're gonna put one quick thing across here. And then last but not least, we're going to give you some Duraplast. And so we can either spray this right onto your perineal area or spray it onto the pad. It all depends on what you want. So this is also a pain relieving agent. It's numbing, and it cools down your perineal area. So she wants to spray on our pad, so we spray it on the pad. And then we put the pad right back on. Before we put the pad on, we're gonna check for the Rita scale, okay? And the Rita scale consists of a couple of different things. We're gonna check for redness, edema, ecchymosis, the discharge, and the location of it, okay? We discarded this, and we put this right back on, and put this on your perineal area. We're also gonna give you an ice pack so you can cool down the area, and you just put it right on top of your pad so it doesn't be directly onto your skin. Okay. And now we're going to come down on our legs. We're gonna check for thrombophlebitis. So we're gonna cover her up to maintain privacy. And we're gonna ask, have you had any pain in your legs or anything like that? I mean, there's no redness, no swelling. All signs of thrombophlebitis. There's none of that. And we're also gonna talk about your TED hose. So you have TED hose on, which helps with, make sure there's no clots in your legs, which is gonna help with the thrombophlebitis. And with your TED hose, we want to make sure that you have them on during the day, but you take them off when you go to bed. We're also going to look for the clonus. Isn't the clonus? So if there's clonus, she'd be tapping her foot uncontrollably. Everything looks good down here. There's no... So, Mrs. Smith, I've done some teaching about if you had a C-section. But another thing, if you got a C-section, we want to make sure you turn, cough, and deep breathe. We're doing this to make sure your lungs are open. We're also going to have you use an incentive spirometer. Okay. So a couple of little teachings I want to teach you, Mrs. Smith, is about your baby. Is their stomachs are super small, so you have to feed her about once every 2 hours. And if she starts crying, right before when she starts to cry, you want to feed her right then. You don't want to let it get longer because it's harder for the baby to latch on when they're crying hysterically. So you want to watch your baby and you want to feed her at least every 2 hours. Okay. So, is there anything else? So, Mrs. Smith, if you have any pain or anything like that, let us know. You have your call light right here. You have water on your side right here. We're gonna make sure she's lowered down. Her bed's in a comfortable position for her. And we are going to, I think that's all we're gonna do. So, Miss Smith, if there's anything we can do for you, let us know. And we're gonna go.